Transition Tuesday. I'm Jane. This is Joe. We're continuing talking about transition to healthcare for young adults, and also our journey into helping Joe discuss his status. Is he in pain? Does he feel good? This is an ongoing process, and we're kind of sharing it with you. So, giving Joe currency. So what I'm talking about with the word currency is value. Another word for currency is money. Money has value. How do we give Joe the understanding that his communicating with me about his pain and being involved in his daily treatments, medication schedules, therapy, doctor's appointments, all of those things have value. They're very important for Joe's well-being and overall health. So how do I help coach Joe to help him understand the value, the currency of that? Particularly since he's a 19-year-old teenager and doesn't really care about doctor's appointments and what medicines he's on. He does care if he's in pain, obviously, but what about the other parts of it? Encourage involvement. This is step one of our process. I need to encourage Joe to be involved. The first thing I start doing is asking him how he feels. Joe, how do you feel today? Do you feel good? Can you tell me with your voice if you're feeling good? You feel okay? You feel okay? I see your smile. I'd love to hear your voice. Can you touch my hand if you feel okay? Yeah. Feels okay. I mean, we all function maybe with a little discomfort, you know. I need to know when he really feels bad, and he's been able to communicate that to me, and that's really important. The second thing about encouraging Joe's involvement is for me to, let him know what we're doing every day. To teach him just the way I teach his direct support staff and share with people who are involved in Joe's life what his medication schedule is. What kinds of things do we need to do during the day to benefit Joe's health and well-being? Some of that may be, hygiene. Some of that may be using a stander or a piece of equipment for him to stretch and exercise. So, show and tell. Good old-fashioned show and tell, Joe. So, every day we have a pill minder. And every week I put the pills in the pill minder, and that's one of the ways that I keep track in my scatterbrain if I gave him the medicines he's supposed to have. We also have a chart because some of the medications are not pills. They're liquid and they stay in the refrigerator. So the chart helps me keep track of, did I give him everything he's supposed to have? So it's very important. The other piece about the chart is if I'm not home and Joe's with someone else, they don't need to call me and say, did you give him? And then I don't have to remember, did I give it to him? It's there. You give him the meds, you check it off the list. I used to be able to remember everything, but now I need help. And really, this is a good communication tool. So it's important. So the thing I've been doing with Joe is in the morning, some of his medication has to be given before food, without food. So first thing in the morning when he wakes up, part of our morning ritual is for me to say, you know, here's your medicines for before breakfast. And we talk about what they are. And I just tell him, as I'm giving them to him, here's this, here's that. And then I come in and I check it off the list. And then when he gets up in the morning and he's ready for breakfast and he has some medications that he takes with food, I say, here's this, here's that, as I go along. Now, I may not show him the medication, which if you had a child that is learning how to be involved in their health care, then you would want to show them the pill bottle, show them the name, show them what the pill looks like, and when they get it. I mean, those are important skills for all of us to have. So, but in Joe's case, because he can't functionally dispense his own meds, I just tell him what it is and give it to him. One of the medicines is refrigerated, so it's pretty easy. I just ask him, did I give you the medicine that feels cold? And he knows. And that medicine is very important because it's kind of a time release thing, so you have to give it within certain intervals so that the level of medication stays consistent in his body and his system, and it's a pain medication, so it's kind of one of the important ones that we give him. So we do all those things, and as I said last week when we first started this discussion about dealing with pain, Joe is, you know, having to really understand by repetition and practice the importance of his involvement in this process, to give Joe currency, to help him understand the value of his involvement in this. You know, it would be so easy for him to just sit there and me never explain anything, just put the medications in and go. Well, that's really not transition. Transition means that Joe's involved in the process. He understands what we're giving him, and then when he goes to the doctor, he can participate in a way where he's knowledgeable about those basic things. What medicines I take, what is my pain level, can I communicate that? Especially for someone who is nonverbal. The worst thing in the world would be for Joe to be trapped in his body, suffering and in pain, and have no way out, no way for people to help him. Am I right about that? Do you think it's important for you to be able to tell people what's going on with you? Touch my hand if you think that's important. Do you want to be able to tell people what's going on with you? Yes? Do you think people are interested in how you feel? Do you think they care about how you feel? Let me ask you this. If you're not feeling good, do you think people want to help you feel better? Touch my hand if you think people want to help you feel better. Or tell me with your voice, either one. Do you think if you're not feeling well, people want to help you feel better? Okay, your hand's stuck on your headrest. That's a problem. Yes. I think he really did want to answer my question. So that's the thing. We have to give it time. For Joe's whole life, people have just been doing things for him, sometimes asking his permission, sometimes not. He lives with a very pushy mama who's always trying to get him to do things, and he does his best. I really believe Joe tries his best every day, but we really need to coach him and be persistent and consistent. So that's what we're going to keep doing. If Joe knew what kinds of medicines he was on, I feel like that's an important thing. I feel like he needs to know who his doctors are, what those doctors do or can do for him. All of those things are very important for a young adult with a disability who is going to probably have interactions with medical people their whole life. You know, we didn't just grow up knowing these things. We had to learn them. And it's different from the experience of most typically developing kids. It's different, but it is what it is. So we just have to embrace it and work towards giving Joe his voice and giving him a good quality of life. So thanks for joining us today, and subscribe to our YouTube channel, Transition Tuesdays with Jane and Joe. If you have any questions about anything you heard, please do, private message me, share, whatever you want to share. We'd love to hear from you. See you next time.